Ms Lennon, please.
Thank you, Presiding Officer. I want to begin by thanking Neil Findlay for bringing this vital issue to the Chamber and for his powerful speech tonight, and also want to thank Amnesty International for compiling the report as if expendable. What has happened to many care home residents during this pandemic has often shocked and horrified at home here in Scotland, but indeed across the world. Behind the statistics of how many social care staff are being tested, how many patients have been discharged from hospital to care homes, tested or otherwise, and the overall level of care home deaths are the heartbreaking realities of lives torn apart and families separated by this awful pandemic. And as always, my thoughts are with all of those who have lost loved ones to COVID during the course of this year. Locally, I have been in touch with dozens of families who were affected by a care home outbreak. One of my constituents lost a grandparent to Covid-19 at White Hills Care Home in East Kilbride, which suffered a significant outbreak earlier in the year. Over 23 residents died during the first wave. And some of these families that I've been speaking to have put it better than I ever could. In response to the Public Health Scotland report that this Parliament has talked a lot about, one constituent told me, and I quote directly from her, "The simple fact is that the admitted patients from hospital into care homes during this time, either tested or untested, common sense should have prevailed. And we have no doubt that this put my gran at greater risk of being exposed to the virus. It's unbelievable that this was allowed to happen. We trusted the management team when they told us my gran was in the safest place. And had we known this practice was taking place, we would have 100% taken steps to have her home with us. She was vulnerable and she should have been protected. We are heartbroken and feel very let down. Our gran wasn't just a number and did not deserve to die this way." Presiding Officer, no one deserves to die that way. When I asked NHS Lanarkshire to provide details under FOI to confirm or rule out that untested or Covid-19 patients had been discharged from hospital to care homes that had had an outbreak, they said that this request was manifestly unreasonable, and I still don't have an answer. So I hope in response the Minister for Older People will say whether or not she agrees with me that that is not a manifestly unreasonable request, because families want these answers. And the Scottish Government, for its part, does need to be more transparent about their treatment of social care. We've heard about the Public Health Scotland report published last week, and what we heard from the First Minister isn't the last word. It shouldn't be. She's admitted that herself, but I, like others, strongly believe that the public inquiry needs to begin. At a minimum, the preliminary work needs to get underway so this Parliament can work with ministers to work out what the terms of reference should be, who will lead that inquiry, what data needs to be gathered now. And for people who've lost loved ones, relatives who are in their 80s and their 90s, who've said to me, it might be too late for us to contribute in a year's time, in 2 years' time. So they want to feed into the process now. In terms of how we arrived at this point, I think it's worth a mention that all governments plan for pandemics. In Scotland, we had Silver Swan. At a UK level, there was Signet. In 2016, Dr Gregor Smith led a review of Silver Swan, and delegates at a conference in the Tully Island Police College in 2016 warned that staff shortages would be a major problem in a pandemic. In the report itself, care homes get a single mention, a passing mention. That isn't good enough, and that can't happen again. The Cygnus report, which was the UK-wide planning exercise for pandemics, warned of the dangers of moving hospital patients to care homes during an outbreak. But this hasn't been properly addressed. So the warning bells were being rung back in 2016. In March of this year, once the pandemic had started, GMB Scotland wrote to the First Minister calling for a national care plan. We didn't get one. I welcome today that the government has published an adult care an adult social care winter preparedness plan, but it's taken us a long time to get there. Also, I've been calling for an older people's commissioner. We should have one, presiding officer. We can't change the past, but we must build a future where the rights of our oldest citizens will always be respected and upheld, starting now.